Pennsylvania's state system of higher education. 14 universities, infinite opportunities.
Hello and welcome. I'm Frank Brogan, the Chancellor of the Pennsylvania State System of Higher Education, and welcome to another installment of Infinite Opportunities. This is our opportunity as a publicly funded state university system to talk to you, our viewers in the Commonwealth, about our 14 wonderful institutions of higher education and the great work being done every day by 100,000 students, wonderful faculty, staff, and administration, helping to chisel out a bright future for our great state. We have a very special topic today. It's a broad topic. We're going to be talking about science and we're going to be talking about health. Either one could probably take up an entire show, but we've wrapped the two together because they are inextricably linked, especially as we move into the 21st century world of science and health. With us today, and to my immediate right, Dr. Jennifer Wilburn. Dr. Wilburn is the Assistant Professor of Mechatronics Engineering Technology at California University of Pennsylvania, and welcome to you, Jennifer. To my immediate left, Jeremy Lazorka, the 2012 Physician Assistant Program graduate. Congratulations, by the way, Jeremy.
Thank you.
From Lock Haven University, and we're delighted you joined us today. And one of his instructors while he was and is located at Lock Haven University, Walter Eisenhower, Professor of Department of Physician Assistant Studies Chair at Lock Haven University. Welcome, Walter. Glad to have you too. I'm going to immediately go back to you, Dr. Wilburn. We have tied these two together because of the impact that technology has had on all things health and all things science as it continues to evolve. Tell us a little bit about you specifically and your journey in the world of high tech.
Well, my background was originally mechanical and aerospace engineering. My doctorate studies involved things like artificial intelligence and path planning for unmanned aerial vehicles. So I guess health sciences may be a little left of center, but I do teach mechatronics engineering technology, and a lot of the automation technologies are finding their way into the health sciences. So I think it's something that we can't really neglect the effect of.
Interesting. And to you, Jeremy, as a student now turned practitioner, and again, congratulations on that.
Thank you.
You have seen firsthand the wonderful work that faculty does, not only in the direct health-related services, but also inculcating into that the issue of technology. Your background a little bit.
Yeah, that's right. I graduated in 2012 and now practicing in family medicine in Mill Hall, Pennsylvania, and practicing in rural healthcare in Pennsylvania. Doesn't see much of the advanced technology that is kind of making its way into the medical world, and the basic information and basic knowledge that we're taught in the PA program at Lock Haven University, I guess, gives us a good basis or background as to practicing adequate primary care, but being able to branch out to use the medical technology if needed in specialty fields.
Walter, you've been involved in the PA Assistant Program for quite a while. Can you tell our viewers a little bit who may not know the acronyms and the titles? What is a physician assistant?
So a physician assistant is a healthcare provider who is licensed to practice medicine under the supervision of a physician. When I started in this career field about 35 years ago, there were probably less than 2,000 of us in the country. And that has mushroomed over the last 30 years to over 100,000 practicing PAs and about 200 programs across the United States. So we were fortunate enough to start the program at Lock Haven University back in the mid-1990s. I think we were like the 96th program in the country at that time. And we've had about 850 graduates, very similar to Jeremy. We're recruiting students from Pennsylvania, especially medically underserved areas, in an effort to get competent, compassionate healthcare providers back into those communities.
Well, let's use that great analysis as an opportunity to take a field trip. Let's go to Cheyney University, one of our 14 universities, and let's take a little bit of a look at what Cheyney is doing in the world of science and health.
Aquaponics is basically the science of linking fish culture together with plant culture.
We feed the fish, their waste is circulated through our system, the roots in our plants take up the water with the fish waste in it and circulate through the entire root structure and the plant itself to grow a healthy plant.
This is an industry that is growing rapidly. So we have a variety of things they can do, everything from the biology of handling the plants and the fish, to the chemistry of dealing with the water.
I would really love to start my own business. I went to Thaddeus Stevens for business administration and water and environmental technology, and I came here because it has exactly what I want for my future. The aquaponics is a business, and it's also science.
My business plan is start my own greenhouse. I was doing growing hemp leaf. People use it for fabric, use it for paper, use it for plastic. It's just a healthier way, a more eco-friendly way of providing different products for the environment.
If you don't get your hands and your arms wet, you're really not learning this industry at all.
You don't want to get into a workplace and not know what you're doing. You should feel comfortable in the area that you're working in, and if you don't have any hands-on experience, then you're just going to cause a lot of problems for an employer.
Aquaponics has been something that has existed for, there's evidence of at least 5,000 years. So this is not a new science, but it's been rediscovered, and with our current pressures on developing and maintaining a food source, it's become a really important thing for the future.
We've had people from different countries come in, and we're very interested in what we do and how our growing system. We've had people from Africa, from some of the Caribbean countries we've had in here, Europe.
How do we get this into areas that are either challenged because of a lack of water or because of a lack of good quality land? Aquaponics is a way of solving that issue. This is about a 10,000 square foot greenhouse. We are doing in this 1/4 of an acre what it would take you about 3 acres to do if you did it on traditional farming. And in addition to that, we do it 12 months out of the year.
Right now we have about 100 stores, give or take, between Acme, Wegmans, and Giant. We also do some small stores, some produce stands here and there.
When I go out to a Wegmans and I see the basil that was raised here in the produce section, it's a tremendously great feeling.
Being able to grow something and having people take it in and using it, I think it's awesome that you get to grow something you're part of, basically somebody.
Cheney University, we're working hard to make this world a better place.
Invest in me.
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 I'll be your future public servant.
I'll be your future advertising executive.
I'll be your future accountant.
I will be your future motivational speaker.
I'll be your future lawmaker.
I will be your future teacher.
Invest in me. I'll be your future videographer.
Welcome back to Infinite Opportunities, and we're talking about health and science and technology. Broad topics, but we've got 3 great panelists who are with us today helping to narrow down those topics to things that are important to our viewers. Again, very quickly, Dr. Jennifer Wilburn is to my right, Assistant Professor of Mechatronics. She's going to talk a little bit more about mechatronics in a moment, engineering technology, and she's at Cal University of Pennsylvania. To my left, Jeremy Lazorka is a graduate of the Physician Assistant Program at Lock Haven University and works in that field. And of course, Walter Eisenhower, who is Professor in Department of Physician Assistant Studies Chair at Lock Haven. Welcome back to all of you, and thanks again for joining us. Jeremy, we're going to start this segment by talking about something that many of our viewers are familiar with because they're reading about and hearing about and maybe even have experienced some of the problems associated with the rising critical shortages that we're seeing in the world of healthcare and all things health. In your new experience as not only a graduate but a practitioner, do you see it? Do you feel that?
I do see it, and as we were speaking, I guess before we went on air, I was saying that I never expected myself to be working as a family practitioner or in general medicine. Prior to this, I had always been interested in orthopedic surgery or cardiovascular surgery, but I'm one of four, and all four of us are in the medical professional field. Two of my sisters are nurse practitioners, and then my oldest sister is a physician assistant as well. And starting in general medicine, family practice, I guess the toughest part for me is in being a family practitioner is developing that rapport relationship with my patients, but having a limited time to gain the medical information or history of present illness when they present, but still taking the time to ask about family and how are their children because of developing that relationship. So when there's a limited time based off of the fact that we need to see a certain number of patients a day in order to provide everyone in our community with adequate health care and efficient health care, I think it's tough only because I see that my schedules now are filled up for 6 weeks. So when we have individuals that call in and want to be seen that day or that week, we're put in a predicament there to where, do I extend my hours? Do I shorten the amount of appointment times? But still being able to have that relationship with my patients. And I think that's where urgent care facilities have come into play, to where if you need something to be treated acutely, hey, we have a local urgent care facility or the emergency department. However, the wait times at the emergency departments have now become astronomical. So I think it's important not to treat every patient or be able to see every patient, but make sure that we're still providing them with adequate health care.
Walter, you and I have been around a while and seen things change in your world. You have seen, I would trust, some significant changes in the world of all things health and how we treat.
Yeah, that's true, Chancellor Brogan. And what we've probably been very unprepared for is providing enough healthcare providers, enough physicians, basically to meet the demands of the population that's increased for a number of reasons. The aging demographic, the baby boomers, and the fact that they're living longer. And I think maybe our insatiable demand for healthcare services. The other thing that's complicated is healthcare has become more specialized and regionalized in its care. It's left a lot of rural communities and other areas underserved for primary care services. And so our goal from the program has been to find students like Jeremy that come from these regions. The research has shown very clearly that it increases the likelihood that they'll return to be close to family and provide those primary care services. So often we're able to keep them from going to the specialties and keep them out in rural communities and providing for our families' needs basically as a referral source and for a primary source of health care.
Indeed. And Jennifer, some of the good news here is while we're looking at shortages, technology has an incredible capacity to supplement human beings for efficiency's sake. You teach mechatronics. Tell us a little bit about specifically what that is.
Well, mechatronics is a subject, it's a multidisciplinary subject. So it's kind of what you get when you mix mechanical engineering and electrical engineering with computer science and control systems. So we're putting together robots, so to speak, but we think of robots a little bit differently than just general mechatronics. But we're automating systems. We're coming up with solutions to problems that can carry out basic rules that we've set for them and be able to really help the professionals that are relying on them to work more efficiently and more effectively, to get rid of some of the menial tasks, some of the things that take up a person's time where it could be better spent in other ways. And I think you kind of hit on this a minute ago, Jeremy. Some of the automation systems that are coming into health science are able to do things like monitor the stats for patients that are in different rooms, maybe ICU, things like that, to where a nurse can handle more patients at one time, but make sure that they're giving adequate care to each one. They don't have to necessarily go to each one of the rooms to be able to see what's going on with each of the patients remotely. Algorithms are available that can actually rank, so to speak, how much of a person's time should be spent basically in a risk analysis on each of the patients, which ones need the most hands-on care. So we're making sure that we're making the best use of our as you've said, limited time.
So you, in essence, get the best of both worlds. You get the power of technology for efficiency's sake, but you don't lose the human equation that always has to be a very important part of healthcare. Let's do this. Let's go to East Stroudsburg, another one of our universities, and let's see East Stroudsburg's approach to the very important topics of science and health.
What a way to sort of foster collaboration by having multiple people from different departments across one college. So we're representing athletic training, exercise science, speech pathology, health sciences, physical education, and nursing, all in a 1-hour radio show.
So we have a variety of topics, so from anywhere from men's issues to women's issues. We talked about campus safety. We talk about bullying. We've talked about bulimia, safe sex issues. Breast Cancer Awareness Month was October. We talked about breast cancer.
We hope that by students listening to the radio show, the goal is for them to improve their own health status by acquiring more knowledge, maybe thinking about their attitudes, if it's about drinking, if it's about drug use, if it's about sexual behavior. And by listening to this show is your information I can get to improve my own health status by making different decisions because now my knowledge level has gone up. What we're really looking for is a healthy community.
And we've gotten feedback from our community is that just basic talking for an hour on a random topic has really had them think about their health and gone to seeing their physicians or their nurse practitioners and have been diagnosed and managed now for a condition they never thought they had.
So I love the fact that the students listen and they kind of can hear how much we enjoy what we're doing. But I actually have been stopped in the grocery store by someone who said, oh, hey, aren't you Shala Davis, exercise science at ESU? And because I had an ESU gear on, and they actually heard a show. So we are making a difference. We're not just impacting the university community, we really are impacting the local regional community here too. They love the fact that we can intermix scientific information with real-life personal experiences.
We all have different parts of the health spectrum that when it comes together in this forum, all the pieces of the puzzle fit really nice and we have a great time. So as the nurse, I'm the clinician. You know, Dr. Rosano, as the health educator, has more of the more global perspective. Dr. Davis, who is the exercise scientist who brings in the movement studies, the exercise, the physiology of the disciplines. And then we have Dr. Ann Milet, who's our speech therapist.
We teach our students all the time it's about a team. You know, in healthcare, you work as part of a team. We thought we probably should walk the walk and talk the talk. And the best way to do that is to have this kind of a venue where you can hear us once a week, collaborating, and actually also enjoying each other's company.
And then we get on the air and it's a general feeling of stress relief to be with your peers who you may not see the rest of the week because you're so busy within your own building, your own department. We get to talk with each other, we laugh a lot.
I actually find that this is my favorite part of the week. I find that for me, it gives me an opportunity to come in and talk to my colleagues about a pressing health issue. I always leave the show learning something too, and I think that's important.
Healthy Warriors airs on WESS 90.3 in East Stroudsburg, Pennsylvania.
I have a beautiful family at home. That's the reason I wake up every morning and do what I have to do to provide for them.
Walmart's commitment to building American jobs is a huge part of what we're doing. We went from 40 people to over 140 people.
When I got the job, it was like fireworks going off. I could be there to take care of my family now.
There's no way that we could grow at the rate we have been able to without having the commitment from Walmart.
Walmart is doing a great thing creating jobs in America. It's amazing just to be a part of that.
Welcome back to Infinite Opportunities. We've got a great group of panelists today, and I want to go right back to them for time's sake and hear what they have to say. We're talking about health and science. And Jeremy, you are a physician's assistant. You went through Lock Haven University, but I'm going to guess in middle school you didn't wake up one day and say, I'm going to go to Lock Haven University, I'm going to become a physician's assistant. How do we draw students and how do we help students navigate the labyrinth of possibilities that are out there to get a degree, get a skill set, and be able to translate that to the real world in which they're going to live?
That's right. I in high school, still was unsure as to where I wanted to go in life, and there's nothing worse than graduating after 4 or 5 years of undergraduate classes and paying for that education and then saying, where do I go from here? I graduated with an undergraduate degree in biochemistry, and upon graduation said, do I want to go into the research field? Do I want to go into the hands-on field? And it took some time. I mean, I worked as a sales representative for a few years until I went through the grueling process of applying to physician assistant school, getting an interview, getting accepted, and so on. But I think it's extremely important to, I guess, build that knowledge. And in order to recruit people to the physician assistant world, I think it's important to educate them prior to graduation, long prior to graduation. So I know giving them information, whether it be in middle school, about the physician assistant world, so that they can kind of get in that mindset of directing them to what they want to do when they do graduate with an undergraduate
Walter,
degree.
this is what you do for a living. When you are trying to market and recruit students into programs, what are some of the techniques you use in order to make that a success?
Well, we've been very fortunate at Lock Haven and throughout the country in physician assistant programs because the profession has sold itself. The fact that people can enter into either a 5-year graduate program right out of high school or complete their undergraduate degree like Jeremy did, and then choose to go through a 2-year master's program to go into the field, people are looking at the decreased opportunity costs that exist with not having to go through medical school. Often they're being advised by their physician colleagues that medical school is a long track and then you're pigeonholed into a given specialty. And with the PA profession, you have flexibility and the ability to change throughout your course of career to various specialties through on-the-job training. So we've been very, very fortunate. But having said that, we still go out to the various state system schools or to other universities. It's a predominantly female profession. About 90% of our students that matriculate into the program and applicants are females, and they're choosing an alternative to going to medical schools. They're very bright, very academically prepared. They're entering into a very competitive market for PA education, and they can complete it in 2 years and enter right into the workforce from
Well,
there.
and Dr. Wilburn, you know better than most. There's a natural belief that young people immediately gravitate into any program that has to do with technology because of the kinship with young people and technology that exists today. And yet it's not that easy, is it?
No, it's not, and especially not when you're talking about a field like mechatronics, which is somewhat of a new word. It's not so mainstream these days, but it is definitely something that's an identified need in many different fields, including manufacturing, the industry, the energy industries, healthcare, most definitely. And where you declared that, well, we're mostly female, we're on the other side. We're mostly male. I think I have 2 female students in my program, and I want more, so by the way. But I think it's really important to encourage students, and it doesn't matter which gender, and that is obviously, getting females to go into the engineering side of things is definitely something that's important to me. But I think it's really important that we do impress upon our students that you have a lot of these opportunities available to you, even as young as middle school, to keep our kids in science, to keep our kids in math, and to impress upon them that if you study and you work hard and you like to solve problems and you like to work with your hands, you like to work with people, you like to communicate. All of these are facets that are available in both the technology fields and in something like the PA field. But there are a lot of these opportunities that are available that kids, I feel like, tend to get stuck into the things that they heard about when they were in kindergarten. I'm going to be a firefighter. I'm going to be a doctor. I'm going to be a lawyer. Well, we've heard about those, but we've got a lot of all of those. Maybe not always enough. Definitely not in terms of doctors, but there are all these other fields that are available to you. So it's really important to be able to impress to our students that there are other opportunities out there if you like to work hard and you like, to solve problems. There are lots of challenging but rewarding fields out there.
And that's another great segue. Let's take another field trip. Let's go to Slippery Rock University and talk science and health.
Physician assistants have a unique opportunity to provide medical care to a vast number of patients in different settings, and they really have a fantastic opportunity to create lasting and meaningful relationships with patients and have a positive impact on their lives.
A PA is trained in a graduate level program to practice medicine under supervision. PAs can see patients, examine them, diagnose conditions, interpret laboratory data, assist in surgery, perform procedures, and really practice a medicine across all specialties.
I've actually been serving for 10 years as an operating room technician, so I had exposure to the healthcare field and got a piece of what it felt like to serve others. And when I was an OR tech, I felt very restricted to what I was capable of doing, and I wanted to serve others more and be more of the process and caring for people.
I've always had an interest in medicine, and I always felt like I had an ability to connect with people and be empathetic towards those in need. My dad's a physician, and I have great memories of growing up hearing stories about his time in the emergency department and in spending time in the hospital where he worked. So that's really the foundation that put me on the path to pursue a profession where I would be able to combine medicine and helping people.
If you look at what PAs are able to do now in this generation, compared to physicians, there's not a huge gap anymore. There's even been physicians commenting that if they knew what they knew now, they would have chosen PA schools.
Our building really is a huge asset to the program, and it is state-of-the-art. So as PA students, to have that special space with brand new resources and up-to-date technology has been great to learn from. The SimMan that we have in our lab as well has been a great resource for us to mock some certain medical situations in a controlled learning environment where our faculty member can be in with us and provide a scenario where we can act as medical professionals but also learn as we go.
We can program in various scenarios. SimMan is having a myocardial infarction, which we can program in. The students will have to go in and basically make those kinds of decisions in real life, such as what drugs to give, what order, based on their biomedical parameters and their vital signs. We'll have a lot more, I think, case-based interactive learning.
There's a huge need for primary care providers in particular, and PAs can really fill that role to increase the access to medical care for patients of the area and reduce the barriers to gaining proper medical care.
I think that there's a strong need in this area. It's kind of an underserved area, and as a PA, I think that's our purpose, is to fulfill that shortage. So I have every intention of sticking around and paying it forward after graduation, and I'm highly looking forward to it.
Welcome back. And of course, today's topic is health and science. I want to thank our panelists again. They did a marvelous job not only talking about health, a broad topic, and technology and science, a broad topic, but did a wonderful job of helping to weave that together. We offer such wonderful programs at our 14 publicly funded state universities in our system, and I believe the future is going to be very bright for the students who pass through those programs, creating a stronger Commonwealth of Pennsylvania, country, and even world. I want to pay special thanks again to Dr. Jennifer Wilburn, Assistant Professor of Mechatronics Engineering Technology at Cal University of Pennsylvania, Jeremy Lazorka, a graduate of Lock Haven University in the Physician Assistant Program and now a practitioner. Thank you, Jeremy. And Walter Eisenhower, a longtime professor and a great friend who is at Lock Haven University in the Physician Assistant Program. Thank you all again for joining us and bringing such clarity to this very broad set of topics. To all of our viewers, thank you, as always, for joining us on this segment of Infinite Opportunities. We hope you'll come back. I'm Frank Brogan.
Come back next week to learn more of the infinite opportunities at the state system's 14 universities, or visit us online